Capitol Report is a production of Senate Media Services.
This week, as the state awaits the governor's decision on reopening schools this fall, key lawmakers weigh in. Plus, how police view the decisions made during the recent riots, and a senator's proposal for a statewide mask requirement. Stay tuned for this week's Capitol Report. Welcome to this week's program. I'm Shannon Loehrke. How schools will operate this fall is a question on every parent's mind right now. Joining me to offer her perspective is the chair of the Senate Education Committee, Senator Carla Nelson. Thanks for being here.
It's good to be here, Shannon.
So Governor Walz is expected to announce later this month how schools will operate this fall. What do you think the approach should be?
Well, I think he's late in announcing, but more importantly, I think the question is, why is this so important? Obviously, it's important for our students' health. We know the American Academy of Pediatrics has recently come out and spoken about how important this is for students' health, whether it be mental health, not having isolation, certainly the educational aspect, nutrition, all of those things. Of course, and we're also finding that the health of others has not been impacted either by countries that have opened up their schools. We're finding that the virus is not as effective, or does not infect children, or nor are they infectious as much as what maybe was originally thought. And I think the one thing that also is on people's minds is economic stability. About 1/3 of our workforce is parents who have minor children. And these parents, and if we're going to see them go back to work, they have to know about childcare and school. And I just got notices today from businesses that are having a difficult time with employees knowing how to plan for their next month's schedule. Are they hiring childcare or nannies 1 week at a time? What does that look like? So that's a problem. And then, of course, parents want that too.
So do you think it should be a statewide mandate, or do you think it should be left up to local districts to decide for themselves how to proceed?
Oh, definitely. This needs to be a local decision. It is impossible for one person in St. Paul to know the conditions on the ground all across the state, 300 school districts, 100 charter schools, all corners of our state, to know what the risks are, how to mitigate those, what the needs are, what the resources are, and that's why it needs to be a locally determined decision. I do not think the governor should be making this decision.
In that case, what about liability? What if a small school district in, greater Minnesota opens, but it leads to the unintended consequences of several grandparents falling ill and perhaps dying? Not that you can necessarily trace it to the school, but the chances of the spread are much greater.
And that is where schools most locally can determine how to minimize the spread, whether it be only a portion of kids coming to school on Monday and Tuesday and another portion on Wednesday and Thursday, maybe some extra help on Friday. How that happens can best be determined at the local level. We could be having schools that are renting small storefronts, open storefronts that are, maybe the businesses aren't in there, but perhaps it could be like a one-room schoolhouse. We could have a lot of flexibility and creativity to keep kids safe, because parents, 64% of parents, 94% of them want their kids back in school full-time, but they want it to be safe. You have to do both. Have your kids there physically, but also have it safe, and that requires that local decision and those local use of resources.
So in terms of following safety guidelines, generally that does mean social distancing. And so if schools do have sort of an individual approach, there's still potentially a lack of funds. If we do social distancing on buses, does that mean more buses? If we do social distancing in the classroom, does that mean smaller classrooms, more teachers? What about the funding ramifications of some of these decisions?
Well, I think that's on the top of everyone's mind. Things are going to be more costly because of transportation, increased cleaning, those type of things. But I also think it gives us an opportunity to do things in an innovative way and do things differently. So again, local decisions, innovation. When it comes to funding, we know that the federal government is really looking at this as well. Already they have sent $500 million about for education to the state of Minnesota. There are discussions out in DC of additional funding to help our schools open safely. And I think that will be needed. Unfortunately, our states do not have money. We're most likely going to be coming back into session with a significant deficit. Unlike the federal government, we must live with a balanced budget, which, by the way, I think is a good thing. But that means we are going to be looking at the federal government for help in allowing our schools to have the resources to open for physical presence of our students in a safe manner.
Now, there's also the issue of disparities, because it has been shown that the students who have lower achievement are also those who don't have the home structure that would lend itself to learning at home. Also, they maybe don't have the technology to even get the work done. Does getting them back in the classroom, despite safety concerns, is that the right move then?
Well, I think it has to be with safety concerns. I don't know that anyone would want their children to go back into a classroom if it wasn't safe. So we can do that safely. We must do that safely. So it's not in spite of, but I will say this, pandemics exacerbate trends. And so we were seeing a trend where we were having children that had disparities in educational outcomes. And that has, I believe, been magnified under the governor's executive order to go to distance learning. And let me say, I tip my hat to our teachers to think that they were tasked with 8 days to prepare 3 months of education, K through 12, to go to distance learning in 8 days. That is an impossible task. And we should not be surprised that, according to many, it did not turn out so well. And now we have to regroup, make sure that our kids get the education that they need, all of our kids, and that they have the resources to do that. And I think it will be a blended learning, hybrid learning, and it will be in the classroom as well, of course. So we need to get those resources to the kids, and we should build upon what we've learned through this distance learning experiment.
What about teachers? Then they're required to go back in the classroom. Let's say they have an underlying health condition, or they're more further down the age range, they're closer to retirement. Sure. What if they leave, or what if they don't feel safe? What, outside of retirement, do they have an option?
Well, I think certainly you cannot make somebody continue on in a job if they don't want to, or if they don't feel safe, or they don't think it's in their best interest, or their health concerns. So I believe that is something that not just our schools will need to cross, but all across our state as things begin to open up, and open up safely. How is that going to impact workers? And also, what if the customers don't come back?
My next question is, like, parents. Let's say the parents are uncomfortable putting their children back in the school. Is there an exemption for them?
Yes, there always is an exemption for parents. Parents can homeschool their children. They can put them in a smaller charter school. They can use a private school. There's a variety of options for parents. And there's also, because of the world we live in now, there's a lot of digital personalized education that's available to kids that was not available at a reasonable cost. We've been able to scale that up now. So there's a number of private entities that are also offering that K-12 learning experience.
Senator Carla Nelson, always a pleasure. Thank you.
Thank you, Shannon.
The Senate committees investigating the lawlessness that followed George Floyd's death concluded their hearings this week with testimony from representatives of the Minnesota Police and Peace Officers Association.
I believe we have the tools, if they're utilized, if we're authorized to be used, to circumvent and stop what happened. I believe the real question, sir, is, were we allowed to do it, and were our leaders allowing us to do our job? And I'm here to tell the truth and the whole truth. And the truth is, the leaders of Minneapolis failed Minneapolis.
During the riots, I was not at the 3rd precinct. There was, I probably was there for a couple hours on Wednesday, and then again I was there on Thursday as well. But as far as Thursday night, I was not there. I was actually in the command post. So I got to watch it just like everybody else on video, and I got to experience just being unable to respond and to help my fellow officers. To watch them go through that was so heartbreaking. To know that they could have died because we were not allowed to respond the way that we have been trained to respond to these situations. To hear our leadership talk about that we're using too many munitions, too much gas. It looks bad. Let's just give them the precinct. It's just brick and mortar. That's not what we stand for. And to watch 54 cops run for their lives from that precinct when the protesters knew that we were giving up that precinct before we did, because they had a barrage of bricks and Molotov cocktails and fireworks planted outside of Arby's. They knew we were going to be fleeing that place before we did. Somebody told them. We didn't know, but they did. So there's so much video out there, so much Twitter video, so much Facebook video of those officers being attacked. Everything that you've heard with officers inside that precinct on Tuesday and Wednesday and Thursday, this might be my last night. I might not come home. Tell my kids I love them. That's all true. Every single bit of it is true. I'm going to save a bullet for myself because I don't want to get taken by these protesters, these rioters. That's all true. Yesterday, Sergeant Schmidt and I spent the entire day talking to 3rd Precinct officers. The entire day. And not one of them was short of tears. They are lost. They don't know if they can go to work. Their children are lost. When you have a 10-year-old son who cannot talk to their father because they're going to work, in tears, that really shakes the core of the family.
Every day that this was going on, and every day since then, I have talked to probably hundreds of officers about their experiences there and how they felt the department and the leadership of our city left them out there with no direction, no plan on how to deal with anything. I was with a cop last week, and all I said to him was, "How are you doing?" Broke down in tears, and he says, "My department left me in there to die." And he texted his wife and saying he thought he was gonna die that night.
I thought there's no way that our leaders, even as crazy as it seems sometimes, would be willing to give up a precinct. Because if you give up a precinct, you'll give up anything.
As school supplies are appearing in stores, Minnesotans await a clear picture of what school will look like this fall. I spoke with the ranking DFL member of the Senate Education Committee, Senator Chuck Wiger. Governor Walz is expected to announce very soon how Minnesota schools will operate this fall. My own kids' schools have been planning for both, in person, a hybrid model, and staying at home. Those are the 3 options that have been laid out. What are you hearing, and what do you think makes the most sense?
I'm hearing a great deal on this issue. People want, and that includes students, parents, staff, they want to return to school. However, it must be done safely and responsibly. And that's the issue in Minnesota and throughout America, in fact, the planet. And so we need to look at what public health is telling us regarding the risk factor that could be posed for students, for staff, for parents and the community. So there needs to be a partnership. And that's why the Department of Education asked all the school districts and the charters to come up with a plan that looked at these 3 options of going back to school full-time, or perhaps a hybrid of being there part of the time or stay at home. I would predict, as we continue to look at the information, that it's going to be a combination of these. Remember, we are still in the early phases of the pandemic. Each day, new information is coming out in terms of infection breakout, potential remedies that we can do locally, what's being done. So the bottom line is we need to look at the public health impact. We want to get back to school. That's very important. I assure you, my grandkids, my kids want that as much. And at the same time, it must be done responsibly and basing that on public health data, not politics.
Well, and often state legislators do encourage school districts to act independently. So should the decision, along with, health guidance and everything else, be left to the local school districts to decide? Because, what may not work in St. Paul could very well work in a smaller community in, a further flung area of the state.
The decision should be primarily with the locally elected school board. I served on the school board for nearly 20 years prior to going to the Senate, and I appreciate that they are closest, the elected officials, to their constituents. That said, there needs to continue to be a close partnership with the Department of Education and with public health in terms of what is the infection rate in the community. The local school boards understand this as well. And I support them making the decision that will serve the best interest in terms of the options of distance learning, in-person learning, or a hybrid. And let them decide, but let's have benchmarks, let's have guidance from the department so it can be an enlightened decision. And this partnership is working right now. There's been over 100,000 people that have been surveyed for input from the department, local school districts, charters, others are getting this input now, and we'll need to continue to have this dialogue. But ultimately, it's conditions, different parts of the state are different, and I would put trust in what the locally elected officials would ultimately do. But working in partnership, which they do with the public health agencies and the department.
Now, I want to get to the funding implications of this in a moment, but before we do, Minnesota has wide educational disparities based on, the outcomes for students of color and poor students versus, more affluent white students. And it has been said that the disparities are exacerbated by the pandemic. Do you agree that it's exacerbated, and can anything be done in the short term to kind of alleviate the differences, to ensure that kids with fewer resources, if they must learn at home, get equal educational opportunities?
Absolutely, there's a disparity in educational opportunity. The evidence is clear, not only in Minnesota, but throughout America, that this has shined light very brightly on the disparity, on technology, the internet access. For those that did not have a Chromebook or internet or a sufficient internet connection with sufficient strength, it's been very disillusioning. And we have found that in particular groups, primarily if you're in poverty, that you are much more at risk. And that has been a huge shortcoming in the technology area. We're working on it. There's been millions of dollars from the federal government, the state government. There's been, information that's been provided into the homes with Chromebooks delivered, et cetera, to address this. Most recent regular session, additional money came, but more be done. That's one area of the disparity in terms of the technology and learning opportunity. Another is just in healthcare. Our schools provide, this is pre-COVID, a number of resources for students, whether it's the counselors, the school nurse, the chemical dependency counselors, the social workers, the psychologists, and this is a part of the school team. In distance learning, this connection has not happened. Some of it virtual, but the face-to-face has not been there in person. And so this has exacerbated the situation as well. And then finally, I just want to mention too, food security. A number of students, particularly in poverty, they get their breakfast, they get their lunch. In fact, sometimes there's even something that goes in the backpack when they go home. And I know a number of teachers and others that help pack these back for students, but the food security issue has only become worse because of this. So yes,
Senator Wiger, we only have 30 seconds left, but will schools need more money, regardless of how they adjust to education in the pandemic? Will they need more funding to accommodate?
Yes, they will. Schools have been scrubbed down, but they're going to need a lot of that in the future as we look at rolling out the hybrid model and distance learning. And there'll be a combination, but they're going to just cleaning supplies, personal protection equipment is essential. For school buses, we're not going to have them packed with 72 students or whatever. You're going to need to clean them. You're going to need resources for additional staff. Over 1/3 of our employees are probably 50 or over, and issues in terms of their own being at risk. So, and pre-COVID, we had a shortage of bus drivers, of special ed teachers, and a number of others. So more funds are needed. I am putting my faith that Congress is going to rise to this responsibility, and together we will get through this. But let's avoid the politics. Let's look at the public health, what's best interest of students, and we will get through this.
Senator Wiger, thank you for your time.
Thank you, Shannon.
At least 25 governors have issued orders requiring some level of public face covering. Senator John Marty proposes that Minnesota adopt a statewide requirement to wear masks in an effort to stifle the spread of COVID-19.
Minnesota is not currently experiencing the resurgence of the coronavirus as other parts of the country are. And Governor Walz is reportedly mulling a statewide mandate right now. You have a bill that would make mask wearing the law of the land. Why is that?
Sure. First of all, I'm very pleased the governor's considering the idea of a statewide mask ban, and I would encourage him to do so. I'm introducing this legislation because during the special session, we've been hearing from the Senate majority saying, oh, the governor's doing all these things unilaterally. These are decisions the legislature should make. So I'm saying if they want the legislature to make the decision, I'll introduce a bill. I'd love to have hearings, have the epidemiologists, have the public health experts come in and talk about how this is so important. And frankly, for business opening, this is the most pro-business thing we could do in Minnesota right now. Texas and Florida and other states that opened up and didn't have mask requirements, they're shutting down again. That's a devastating double hit to businesses. Once we're getting our businesses opened up again, the best thing we can do is keep the rate of COVID expansion down so they can keep open. So I'm introducing it partly because a lot of my Republican colleagues have been saying the legislature ought to be making these decisions. So I'm saying, give us a chance, let's try it.
So there appears to be a partisan divide on the importance of masking, and I've read a number of posts now on social media that are saying that a mask mandate impinges on personal freedom. How do you respond?
Okay, it's a responsibility. We have lots of things we have to do in society. You have to follow red lights. You have to pay taxes. You have lots of responsibilities as citizens to take care of each other in a way that works. If we didn't follow stoplights, then you'd have I have the freedom to drive when I want, where I want, what speed I want, and so on. Yeah, then you have lots of dead people around because people crash into each other with no laws. And so we do have laws that people comply with. And the way I'd focus on this is, first of all, look at the difference of what the burden is. I use the illustration World War II. We had all kinds of very serious rationing things. Talk to people who were alive in those days. Rationing of gasoline, of rubber, of food supplies, and so on. Those were huge sacrifices. We're asking for a tiny sacrifice that people put a mask over their face when they're out in public to help prevent the spread of disease.
Well, and that was my next question, because in the statement that was released in announcing this legislation you're proposing, you quoted World War II and the sacrifices that people made in order, for the greater good. So why is it different now? What's different about America now that people don't view the collective good as better?
Right. Well, among other things, first of all, we should not be thinking of this as a huge sacrifice. But in World War II, it's not like everybody loved rationing. They didn't like rationing. They didn't love restrictions on how much gasoline they could have, how much food they could buy. They didn't like those restrictions, but they lived with them because they realized it was for the common good. They recognized we're all in this together. And so I would say there's a lot of the same thing. People are going to grumble no matter what we do. We expect the grumbling. It's going to happen. But most people do comply with the law. I think the reality is any community that's put in, the local governments that have put in mask wearing mandates, it's been helpful. And I think a lot of business owners say it really helps so that they're not the ones who have to tell people, we've got a policy against this. They can say, the law says that, so we have the law behind us. So I think what we have to recognize, there will be complainers. There will be some people who refuse to comply. And hey, you know, if we get 90% of the public wearing masks and following the law, that's real progress, and that will slow down the onset of the spread of the disease.
Children under the age of 8 and those with underlying medical conditions that would make wearing a mask challenging for breath are exempt from the proposed law. That said, the bill's only repercussion is that not wearing a mask, that businesses can refuse service to those refusing to wear a mask. Is that enough? Does this bill need more teeth?
Okay, first of all, I would say, no, it shouldn't need more teeth because people tend to follow the law because it's the law. If people are told they're not allowed to do something, most people comply. Not everyone, but most people do. And that alone is huge progress. In terms of the penalties under Minnesota law, if we create a new law and doesn't specify the penalties, it counts as a petty misdemeanor. You can't lock anybody up. You can't do anything like that. But you can give them, I think the current fine is $100 maximum. And the whole point of this isn't to have mask patrols out there, to have masked police or something like that. No, the goal here is to have people comply. And I think the reality is most people will comply. And there was a study out of the University of Washington Institute for Health Metrics that said if 95% of Americans would wear masks when they're out in public, either indoor public spaces or outdoors where they can't socially distance, if 95% of Americans would do that, that would reduce the death toll between now and the beginning of November by 45,000 lives. We've had about 130, 140,000 deaths so far in the US. Projections are that by November, under current goal levels, we'll probably have about 210,000 lives. And we cut that death toll significantly by 45,000. That's almost as many people as were killed during the entire Vietnam War. So that's a huge savings of life. This is a small sacrifice we're asking people to make for the benefit of others.
Senator John Marty, thank you.
Thank you. And one last thing, I tell people refusal to wear a mask is not a matter of toughness. It's a matter of rudeness. Public health experts routinely say and clearly say that not wearing a mask doesn't hurt you as much as it hurts the people around you. We wear masks to help others. That's what we're doing it for. I hope we can pass the law, or I hope the governor will make it happen on his own.
Thank you, Senator.
Join us again next week as we delve into more topics affecting Minnesotans. I'm Shannon Loehrke, and on behalf of all of us at Senate Media Services, thanks for watching.